So welcome everybody. Our presentation is called Decolonizing and Community-Driven Approaches to Indigenous Research. I'm really glad to be here today presenting with my wonderful team member, Shannon. I just want to acknowledge again that we are so grateful to be presenting today and to live, work, and raise my family and play on the traditional unceded homelands of the Musqueam, Squamish, and Tsleil-Waututh nations. We're going to talk a little bit today about who we are as a team, who we are as researchers, about contextualizing Indigenous research, decolonizing research, and engaging with Indigenous peoples in research, and a little bit about our work as well. This slide to me, this is my family, and this is something that explains a little bit about the relationality that is necessary for Indigenous research. You know, typically we're taught in academic settings that we don't include ourselves in the research, and we actually do the opposite in Indigenous research. So it's very important to introduce yourself and position yourself as the researcher, position yourself within your family and your community. And so when I do my introductions, and how Leslie and Shannon also do a wonderful introduction, is that, you know, first and foremost, I am a mother, a daughter, a sister, a niece, a wife, a member of my community, a member of the Seashell Nation, and then after that, I'm a researcher and an academic.
Yeah, so Leslie gave us this wonderful introduction, but yeah, we did want to go a little bit deeper. So I'm Métis and Cree and Swedish on my mom's side, and that first picture there is a picture of me and my mom. And then I am English and Irish on my dad's side. Unfortunately not pictured here, but still there, and I have great relations with him, and so both of them have, you know, informed the ways that I walk in the world. So acknowledging them. Also getting all my craftiness from my mom, right? Those skirts that me and my mom are wearing or something that I've sewn. I'm also a beater. So that's a picture of some florals I've done. And Leslie mentioned that I'm doing my undergrad in kinesiology. I've also been working as a community kinesiologist for the last 5 years. And so that's sort of where my passion in health is, you know, how do we use movement, but movement in a really holistic way. And so all of those things inform how I go about as a researcher. And I'll talk a little bit about some of how our worldviews influence our research practices later.
So this is our wonderful small but mighty research team that we have so far. This is some of our research team members. We have some big goals. This was a meeting that we had outdoors not long ago, where we spent a lot of time brainstorming some big ideas and potential collaborations and partnerships for our team. So we're also linked with quite a number of other research teams throughout VCH and beyond, building relationships to contribute to Indigenous research in a variety of ways. You know, I want to show this slide also to mention that in Indigenous research, the team environment is extremely important as we take a relational approach to all of this work. Part of the work that we do is not just outside of the team, but working on locating our positionality as a team, working on decolonizing ourselves as a research team. And we also work from a two-eyed seeing perspective, which is where we're bringing together diverse views from the Indigenous lens and the non-Indigenous lens, and really allowing space to honor each of our team members' unique and important gifts that we bring to this work.
So for any of you that have taken our ICS training with our team, know that we introduce you to some of the historical acts of oppression and colonial violence that's been enacted against Indigenous people. But we don't often talk about this in the context of research. So, I would hope that most people are at least familiar with the residential school system. And this was closely tied with the Indian hospitals, which were segregated like hospitals for Indigenous peoples. They're typically understaffed or underqualified staff, right? Children were taking care of children. And much of the same abuse that went on in residential schools was also happening in these hospitals. In addition to this, the government was also funding research at these institutions, such as vaccine testing and nutritional experiments. And so a lot of the knowledge that we actually have on things like nutritional deficiencies are at the hands of starved Indigenous children. And so when we think about the systemic oppression, when we talk about oppression against Indigenous people in particular being embedded within the system, this is sort of what we're talking about. So a lot of the knowledge is built on unethical research practices in the past, and it's actually still ongoing. And another point to note is that within none of these examples of research had any kind of consent from the children or from their parents. People didn't understand what was actually happening to them. You can find some stories online of Indigenous people explaining their experience and saying, I was injected weekly with, I have no idea what. And so there's been a lot of harms with Indigenous peoples in research in the past. And Brittany is going to talk a little bit about the importance of, moving forward with really stringent ethical practices moving forward. But I also want to talk about it in terms of what other impacts have this had on Indigenous people, right? In addition to all that psychological trauma, a lot of these things have led to higher rates of diabetes and heart disease and cancer, and that list goes on. Brittany, do you mind hitting the next slide? Thank you. So in order to be able to analyze our research, we need to be able to contextualize it, right? So we need to have a deep understanding of the historical and systemic harms and how they exist today. So for anyone familiar with the social determinants of health, that big web that has, all these complex layers to it, when we talk about Indigenous peoples, there's even more layers wrapped into that. And even though that learning these issues and discussing these issues can be really upsetting, it's not something that we can avoid. I know some of the other speakers throughout this throughout the summit have been talking about this, right? Not shying away from this history. And I think that's part of that healing process too, and that's going to bring us to that point of reconciliation, is facing some of these traumas and working through them so that we can transfer these, any like negative emotions into actual really positive actions. And we also need to be able to reframe health disparities. So with any of that knowledge that we're taking, right, when we see research that's saying that Indigenous people have some sort of health disparity, we have to know that Indigenous peoples aren't inherently sick, but they're suffering from symptoms of colonial violence. And we don't necessarily need more research that demonstrates these health disparities, but what we do need is research that's action-oriented and actually works to close these gaps so that we can bring about more health equity. Next slide, please. And so in addition to learning our history, we also really need to emphasize this process of self-reflection and the process of humility, right? Considering, what are our biases? What do I know about Indigenous people? Where did that information come from? How does our team operate? What sorts of ontologies and epistemologies do we use? And how am I going to commit to do better? And for some people, recognizing their complacency in colonial oppression is really upsetting. But again, we can't ignore that. It's part of that healing process. And it's about navigating those feelings and coming out ready for action. And just letting you know, pictured here, the First Nations Health Authority has a hashtag called It Starts With Me, and that's related to their promotion of Indigenous cultural safety. And pictured is our lovely VCH team, and it concludes Leslie there and Patty Daly, who's the VP and Chief Medical Health Officer. Next.
So this is a definition that has been put forward by the Urban Indian Health Institute in Seattle, which I really love, defining Indigenous epidemiology as applying traditional knowledge for a strengths-based analysis of Indigenous data and analyzing data with prayerful intent for the well-being of the people. And then in follow-up, defining Indigenous research as a radical act of resistance against all that oppresses us, done for the love of the people and recognizing that we have always been scientists. And as Cindy Blackstock told us yesterday, every social movement has to begin with the foundation of love. So I love how this resonated with what she said as well. So in decolonizing Indigenous research, historically research, as Shannon mentioned, has been harmful to Indigenous people. And now research with Indigenous communities requires us to use different methods, to use more participatory methods and more community-driven methods. We need to focus now on decolonizing some of our research processes and making sure that we have really rigorous Indigenous ethics. And part of that includes making sure that we are privileging Indigenous voices and Indigenous knowledge in the research. In a lot of our research projects, we're also, involving elders in every stage along the way. And that's part of how we make sure that we honor Indigenous knowledge throughout. We also must link the research directly to policy, action, and change. I really took home a point that Cindy Blackstock told us yesterday about, that children can't wait while we have meetings, do research, and write reports. That we need to stay connected to the fact that things are happening as we're doing this work. And that's why it's even more important that we link this to real action and change. All of this work has to be built upon equitable partnerships and of course humility. And like Leslie mentioned, a phrase that underlies all of our research and our work is nothing about us without us. I'm going to talk about some of the different aspects of decolonizing research. Decolonizing data is something that we have been having discussions on a lot more recently, and how decolonizing data can be considered also an act of reconciliation. So in order for us to reconcile, we're also required to have a deep understanding of the historical and systemic harms. This is what helps us frame our understanding of data and also frame the ways in which we collect data and the ways that we use data. Sean Wilson, who writes a book called Research is Ceremony, talks a lot about how when we are doing Indigenous research, it is ceremonial and relational, and also that we are responsible and accountable to all of our relations in that work. So decolonizing data through incorporating ancestral wisdom with the data collection, using Indigenous frameworks for how the data is collected, gathered, and also using community input to determine how we interpret the data coming out of that analysis. A baseline measurement is really needed for all of these reconciliation actions. And this is the importance of some of this, the data and the data gaps, and how important it is for us to begin filling these gaps. We need to continuously be able to measure and determine our progress for reconciliation actions. And also this is what keeps us accountable. Invisibility in the data. Indigenous people have been largely rendered invisible in health data. We talk a lot about evidence-based healthcare and how we draw all of our decision-making from the body of evidence. And yet Indigenous people have been largely marginalized from that evidence. Data gathered from marginalized communities is seldom used to actually serve the communities themselves and is often mostly framed within a deficit approach. So when we talk about decolonizing approaches to data and how this is urgently required, this means that we have to outline strengths. We have to start looking at things that perpetuate Indigenous strength and self-determination, and things that help Indigenous people to thrive. We do need to highlight the gaps, but within the lens of facilitating action on inequities. This is just a visual of some of the different levels of decolonizing shifts that our team is aiming to focus on. So when we're looking at data and that large data level, we're looking at large data sets that inform action on Indigenous health within our system and throughout our province, and how these large data sets can be analyzed and interpreted using community voices. We want to consider how community voices can influence this data and the use of this data to be transformed into real change, and to allow the community to control their own stories and make decisions that are for the best for their people. Within our research team level, as I mentioned, we have created two-eyed seeing research teams that privilege Indigenous voices and also work in service of the community to conduct research that is action-oriented. But not only are we working in our own two-eyed seeing research teams, but we are also working in partnership with a number of other research teams across the system. And this is part of the way that we can ensure that the Indigenous lens is present in other research teams in a real and authentic way. For the community level research, we really see ourselves as researchers who are in direct service to the community. We've gone through an academic system, we've learned a number of different research skills, and then we've also learned and gathered knowledge through our community work that can inform us to be of service to the community through conducting research. So we make sure that we stay connected to the why we're doing this work, and how we can best do this work to bring forward community recommendations.
So the next really important piece in this conversation is about authentic engagement, and what that really means, what does it mean to engage with Indigenous people. So the first part that I wanted to introduce you to is something that, if you are familiar with patient-oriented research, you might have seen this before. It's the International Association for Public Participation Spectrum. And so really what it is just a tool for researchers to kind of reflect on where they are at with engaging with their communities. So it starts with informing, right? Just providing information to your community partners, consulting, starting asking for feedback, involving, collaborating, which starts to get at some shared decision making, and then finally empowerment, which is where the decision making is actually in the hands of the public or whoever your community partner is. And so we're really aiming sort of towards that right side of that scale, but also respecting what our partners actually want. How much engagement do they want on any sort of project? But regardless if we're not handing over full decision making, I think that research still has a lot of other ways in which we can empower our community partners. And so the next one I want to talk about is more of the Indigenous perspective, and including some of these buzzwords. So if you want to go next slide. So this looks at a spectrum of inclusion, reconciliation or performative reconciliation, and decolonization. And so when we start with Indigenous inclusion, this is really focused on just increasing the number of Indigenous people that you're working with, whether if it's in research, right, members maybe you're putting an Indigenous person on an advisory committee, or you're hiring an Indigenous student. And it tends to become that one token Indigenous person, and for larger organizations, sometimes it comes about in quantity versus quality, right? I think a lot of diversity practices were very focused on, let's just hiring our quota of colored people. But we're really sort of coming into these conversations, right? VCH is making big steps towards re-looking at diversity, equity, inclusion. And so that's starting to get into this next step of hopefully reconciliation, and hopefully not performative reconciliation. And what I mean by that is that reconciliation has become really popular with documents such as, and the organization of the Truth and Reconciliation Commission and their 94 calls to action. And so all these institutions are saying, okay, yeah, we're going to do all this in the name of reconciliation, but it often ends up being this really superficial level of reconciliation, or something, that I would consider as performative reconciliation, right? So maybe that they're bringing in community members to do a welcome to the territory, or putting up Indigenous art. And unfortunately, though, it lacks a lot of the additional transformations to the system that are needed. Or sometimes there's even false commitments, right? They're saying that they're going to uphold the calls to action of the TRC, but it sort of lacks that follow-up and that commitment to actually transforming systems, changing policies that actually lead to real reconciliation. So one of the examples that they came across recently, really specific to this, was the COVID-19 pandemic is, closing off a lot of communities. And in the Atlantic, along the Quebec and New Brunswick border, a lot of communities, they're like twin towns at the border, share services. And so in one of the towns, the Indigenous peoples are on a reserve in Quebec, and they have to travel to New Brunswick for school. And their school's been known to do land acknowledgements, right? Acknowledging that they're on the traditional unceded Mi'kmaq territory. But with COVID, they've actually closed the border and said that our Mi'kmaq students from this reserve can no longer attend school because you're considered non-essential travelers and you can't cross the border. Despite this being your territory, we're going to close you off and not allow, but everyone else, within our city can still come to school. And so people were really upset with that. And that's what I mean about that performative reconciliation. We're saying that we're going to work together, but then there's that lack of follow through and action. And then the last one is on decolonization, which is more representative of that empower state. And so that's really requiring organizations to be fundamentally transformed, empowering Indigenous peoples to govern their knowledge systems. And Indigenous communities are respected as a sovereign body with leadership over research projects, and researchers are really, non-Indigenous researchers are really acting as this tools, right, for gaining access to different resources. Maybe we have more access to advocating for policy, right? Like me, myself, as an Indigenous researcher, but I still work within the system and I can advocate for policy change because I'm that much closer than somebody who isn't working within the system. And then just going to dive into these a little bit more in terms of that really authentic piece. So Brittany, you can go next slide, please. And so if we're going to step up each of these pieces, if we're going to talk about authentic inclusion, we're going to really privilege Indigenous voices. And again, right, it's not that tokenization piece. We're really making this community-centered, because Indigenous peoples come from community-centered nations, and no one Indigenous person speaks on behalf of other Indigenous peoples, particularly without consulting them. So we can't just hire our one Indigenous person onto our advisory committees or onto our teams, because not only is that isolating, but that, you know, prevents that process of really getting that community feedback. And the other piece of that is elder-led research. And so elders are really traditionally the people who we've gone to guidance for in communities, right? They hold a lot of knowledge about our communities. They know how to work with people. And they should really be included in the research process if we're going to go about things in a good way. So authentic reconciliation, right? Leaving that performative part behind and really learning to work together. So again, learning that history, being able to contextualize information, reflecting, knowing our positionality, what our biases are. And it's also important, another piece of Indigenous cultural safety is to recognize that we have different worldviews, right? It's okay to be different as long as we're not harming each other. And it's about learning to work together. And there is a resource I really like called Towards Braiding. So that's just that link there. It's on decolonialfutures.net. They have other resources, but Towards Braiding actually talks about some of those ways that we can work together while working from two different worlds, right? Because our worldviews, you know, how we've grown up, the cultures that we live in, things that our parents have taught us, things that media has taught us, influence everything that we do. It influences how we gain knowledge, how we interpret it, how we communicate, what our priorities are. So when we're working with a diverse team, it's really important to sort of navigate how we're going to best work together. And then doing so, right, that's how we create these really strong two-eyed seeing teams, because we can be able to pull from each of our strengths and work together. And then doing that, you know, that's that process of reciprocity, is that we're actually sharing knowledge with each other, we're working together, we're learning from each other, and then we're giving back, and to consider also how we're giving back to the communities that we're working with. You know, are we providing through our research training opportunities, mentorship opportunities, even if it's just sharing a meal, right? That's also that building that relationships. And it's really important to create those safe spaces and give recognition to our partners, whether it's in our papers, our presentations, we're paying them appropriately. And as we, you know, start to pick up all those things, that's when we can really start to move into the last piece, which is decolonizing research. Next slide. Right, so we've done a lot of this work and we've built our relationships, and now we can really start transforming and doing decolonizing research, right? So Brittany's spoken to a lot of these points already, but you know, it's about how we can continuously reflect on our power positions and how we can make research really empowering for our community partners and for Indigenous peoples. Whether it's giving them research positions or advocating for policy change, but really working with Indigenous peoples to, you know, not determine what sorts of things we're going to do to empower them, but to let them tell us, you know, what do they need? What do they want out of this research process? And then we'll move on to this slide here, which I just wanted to go over an example of our research projects, or one of them anyways, which back in 2019, our team held a research project in which we did 2 small talking circles. And we wanted to find out what some of the healthcare experiences of Indigenous peoples were around Vancouver. And so our first step was we invited Elder Roberta Price, who you've seen throughout this summit. You know, she's someone that we've had a close relationship with already. And when we went to her, she also recommended that we include Elder Doris Fox, who's also been a part of this summit. And we were really happy to have her as well. And so we really worked with the elders throughout this research process, right? We designed our question guideline for the talking circle, and we brought it to the elders and made sure to get their approval and their feedback on it and make the changes that they wanted. And then on the day of the actual talking circles, we went to the elders first, asked them, you know, how they wanted to guide the day. And, you know, we didn't start until they were ready to start. And we made sure to welcome all of the participants as they were coming in. We did lots of informal introductions. We shared a meal together, and we just made sure everyone was feeling really comfortable. Yesterday, Elder Roberta talked about, you know, how do you work with an elder? And she talked about making sure they have tea, right? Something to drink, something to eat, somewhere comfortable to sit. And so we didn't do this just for elders, we did it for all of our participants. And I think that really sets the stage of what kind of intentions that we have for our participants, and that's part of that trust gaining process. And, you know, that's when they start to feel comfortable with us and ready to share their stories. And again, we weren't following any strict schedule. We really let the elders start when they wanted to start and ask the questions and sort of re-guide that circle as they felt needed. Elder Roberta shared with the participants some medicines and some medicine bangs, which was really lovely because a lot of these healthcare experiences for Indigenous people aren't happy stories. And so bringing that medicine into that process just sort of helped that healing process, right? Sharing your story, but also being around medicine. And we really wanted to acknowledge our participants. So we thanked them for coming. And we made sure to pay them their honorarias, give them thank you cards, and make sure everyone was safe to get home and felt okay leaving that circle. And again, it's really their story to tell and our story to share with their consent. And so the manuscript that we have based on this project is full of quotations from our participants because we wanted that community voice to shine. And really it's our duty as researchers, right, to use those resources that we have to privilege these Indigenous voices and make sure they're shared in a good way. Brittany, did you want to share anything else?
Yeah, you know, one of the observations that I have when we do these circles is that the process of research in and of itself, when all of those steps are followed that Shannon outlined, and the presence of our elders and the fact that as researchers, we're really just holding space. We're holding space for the participants to share their experiences with us and receiving that story in an open-hearted way. What we've heard is that the experience of participating in the research is empowering in and of itself for the participants. You know, another example that I wanted to give is that we worked very closely with a group of women who reside on the downtown east side and are part of a grassroots organization there. We involved a group of women in our research planning meetings. And from the very beginning, we always did the same thing and made sure that these members of the community were coming to the table and coming to our office and feeling safe, and that their voices were honored in our research team meetings. At the end of one research team meeting, one of the women sort of pulled myself and another researcher aside and said that they had never been a part of a table and part of a research process where they truly felt that everyone actually wanted to hear what she had to say, and that everyone was valuing so much her words, and that it made her feel empowered, and that she was smart, and that her voice mattered. That was the first time that she had felt that way, being part of a research process. So that was a real, sort of light bulb moment for me in this work, that not only the way that we set the stage for working with participants can create an empowering experience, but also the way that we involve people of lived experience as part of our research committees and a part of our research teams, and really honoring those voices can make immense shifts. And that's part of how, I see the words of Sean Wilson saying that research is ceremony, and that's really how I've seen that enacted in this work so far. So this is just a little overview of sort of where we're thinking that our team will be going in the future, and how we're trying to structure our work. We are a new research team, and as I showed, we're a small but mighty team with a lot of big goals. But some of the role that we hope to take is that we plan to lead research ourselves within our team. And so we actively pursue research grants. We've been fortunate enough to be awarded several really amazing grants to pursue this work so far, and we'll continue working on that front. We also plan to have a little bit of an advocacy role and a strategic role when it comes to Indigenous data. We have noted and seen that there is an immense gap in Indigenous data when it comes to giving us the ability to plan. That has become very apparent with the COVID-19 pandemic, and really having detailed and rigorous data that we can look at that informs public health response in a timely manner, but also overarching rigorous data that can inform us to set priorities and examine gaps in where Indigenous people have inequities within our systems. On the partnership front, our team will work with other research teams across the system, making sure that we are creating those two-eyed seeing research teams and presenting the Indigenous lens within the research, and also making sure that that's done in an authentic way. And we've been able to take part in a number of really productive and rewarding partnerships so far. So that's something that we hope to continue doing. One of the areas that we really want to build upon is our mentorship and capacity building. Some of the discussions that we've been having was around, cultural safety and how that plays out in research, and how, we need to create a culturally safe environment for young Indigenous scholars to come and work on these research projects with us and with our partnership teams in a way that empowers them, that makes them feel safe, that provides mentorship, and ultimately builds capacity to have, the next generation of amazing Indigenous researchers who can potentially be mentored by our team and by our partners. So that's the ultimate goal going forward.
And in closing, I just wanted to share a quote from Thomas King that I just really like. So this is from his book titled The Truth About Stories, A Native Narrative. And it says, "It's yours. Do with it what you will. Cry over it, get angry, forget it, but don't say in years to come that you would have lived your life differently if you had only heard the story. You've heard it now." Right? So knowledge is power. Keep listening, keep learning, right? Take your time. Cultural safety is a really long journey, and it takes time to build relationships. But, right, we're here to start working together. And so let's do research that builds a better future. And I guess that's
amazing.
We're pretty on time.
You're so on time. You're so perfect. That was really good, you guys. Very, very thought-provoking, empowering. I feel like you really centered the approach of Indigenous research in Vancouver Coastal Health under your guys' great leadership. That was a brilliant presentation. And while you were talking, of course, I'm scrolling, looking at who's all present here, and I just want to acknowledge Andreas and Christina, other members of your dynamite little team who contribute and bring that knowledge. I know you mentioned them already, but I thought I would mention them as well. Some of the things that really resonate as you were talking about this reflection and this relational approach, it's so important. Somebody asked in the chat box, how do we move from authentic reconciliation to decolonization? And they're kind of both the same, and they do the authentic reconciliation leads to some of the decolonization efforts that we're looking at. In particular, what you've really demonstrated is that we are moving away from this extractive model of taking knowledge, taking history and information from people, particularly the Indigenous population, and then just doing what we want with it, analyzing it and telling the story whichever way. That's the normal system. What's been so rewarding and refreshing is watching this research team and the work that we've done in the past, Brittany, at Fraser Health too, is really privileging that community voice and having the empowerment to disrupt the system a bit, to say that way isn't our way and we're not going to participate in that research, right? We're not going to sign on to your research team. We get invited all the time to all sorts of different research projects. But if it doesn't clearly define how it's going to improve the health outcomes of Indigenous people or access to care for Indigenous people, we actually sit in a position where we can actually just say, no, thank you. We're not interested in participating in that research because it hasn't come from the community. It hasn't been identified as a priority. And I think that is one of the areas in which we can lead by example in this work. Someone else mentioned just seems like such a beautiful approach. What, you feed them? You get them a cup of tea? I mean, yes, that is kind of not a normal practice for researchers a lot of times, to think about how important it is to set the table, to have these conversations. So I guess, I don't want to answer these questions for you, so I'm going to ask it again. How do you think, Brittany, we move from this authentic reconciliation to decolonization, or how does that resonate for you in this work?
I've been doing a lot of thinking around, can we decolonize research when research is conducted within a colonial system? And that's really the big question. And I think that that's what we are beginning to challenge a little bit. The academic system is a very old system, and it determines what we see value in, what we see as legitimate knowledge, what we see as legitimate evidence. And those are some of the things that get challenged when we're doing Indigenous research. So, what needs to be challenged when we're talking about these decolonizing approaches and shifts to research is some of the things are how we value academic contribution. So, our academic system is created in a way that we have scholars working for under certain guidelines for how they are proving that they're successful. Mm-hmm. And that isn't always conducive to decolonizing research and truly being of service to the community. So if we're of service to the community and we are, writing a grant that the community has requested, or doing a project that the community has requested, that doesn't necessarily mean that it'll happen on our academic timeline. It doesn't necessarily mean that we will emerge from it with academic products that help us gain bigger, fancier research careers. And so it's that shift of, you know, who are we really doing the research for? And I think that when researchers are approaching communities to do this work, that the communities can really see when it's truly reciprocal and when the reciprocity is there. And I think that that's one of the main shifts that we are doing in this system, is honoring a different way of looking at data, a different way of looking at the research, and actually seeing that this research is ceremonial in that we are gathering people's stories and people's voices. And as you always say, Leslie, like, we're witness to that. And in the research, we are witness to what people are sharing with us. And it's actually our duty as researchers to take that knowledge that we've been given and put that out into something that can lead to actual change.
Absolutely. And I've been witness myself to you two conducting research in that way. Shannon spoke a bit about the circle and having both Elder Roberta Price and Elder Doris Fox doing the research with the women from the downtown east side, creating all of that safety, and that testimonial in itself speaks to the importance of making that kind of approach and that leap into that. One of the participants also asked if we were working with VCHRI, the Vancouver Coastal Health Research Institute, and I guess I'll take a crack at answering that one for you. Yeah, kinda. We don't really fit into their structure right now, but we hope to find our way into a deeper, more meaningful partnership with VCHRI. We're in this together, of course, but we're very focused on population research, population based research, community driven, participatory, Indigenous, and that right now doesn't fit into the clinical trials and the other kind of focuses of VCHRI. We tend to focus more on that prevention, intervention and prevention type measures. Our research actually takes a look at, and our evaluation looks at, if we do this, can we change that? If we try this, will it affect that? And I'm thinking back about, Brittany, you spoke about, you know, that building community capacity. And I'm thinking about the research project that you and I both worked on, community participatory led, youth on the land as a preventive intervention and prevention measure, no, post-vention, intervention, preventive measure of youth suicide in the Stalo territory. And maybe you can just recall some of the benefits of that. I mean, I could go on, but I think everybody wants to hear from you about your experience as an academic. As I think back then you were our research coordinator, just starting and contemplating a PhD.
Yeah, I mean, that was one example of a project where a lot of time was spent on the team aspect of things and preparing the team. I think that there was up to a year of time that was spent just bringing the team together, making the team work cohesively, having everyone work through their own process of decolonizing themselves, from how we've all been trained in academia, we've been trained in all different ways, and kind of merging together the traditional teachings around research and knowledge, and merging that with what we've all been trained is valid knowledge in the Western academic system. And everyone was in the process of sort of reconciling that. And not saying that, you know, we're knocking the value of the Western knowledge, but we're really, as Albert Marshall says in the two-eyed seeing approach, we are you know, bringing each person's unique gifts to the table and drawing from the strengths of each of those approaches. So, you know, there are times when we need the statistical, you know, Western research approaches, and that's really strong for the work that we need to do. But that can actually be done with the Indigenous lens also present.
Right. The other thing that came to mind from that, I remember that's where the phrase was coined, researching. That we weren't just doing this research, we were researching and going back to Indigenous ways as a form of decolonizing the way we were doing things, trying to go back to the way that our elders and ancestors in the past wanted us to go back to the old ways, that there was value in the old ways. We didn't have youth suicide in the old days, right? And so what was missing, what was disrupted in that time? It was a really interesting project. And I think we made a significant advancement for the youth on the land out there. One of the other questions here, thank you so much for an interesting and informative presentation. And the question is, what research projects are the two of you currently involved in at VCH?
Yeah, so I feel like I should let Shannon answer something.
Our little research coordinator that's always doing all the back room finding us funding. Shannon, what are we working on these days?
Our two big ones are, well, the one that you titled in our introductions was the project that's related to COVID-19. And so we're actually, it's looking at a really cool data software. It's the Vancouver Community
VCAT.
VCAT, yeah, I don't know, oh my goodness. I don't remember what it stands for. How embarrassing. Very amazing technology, though, that shows patient data. And so we're going to look at trying to see where some of these gaps in service has occurred during the COVID-19 pandemic, where, you know, there might be certain hotspots around Vancouver with certain risk factors related to the severity of COVID-19, and really working like through some of the processes we talked about in our presentation in terms of it, you know, really working with our community partners to establish what their needs are. Brittany, do you want to add in more about that one?
No, you covered it, but for sure, you know, anyone, if they want to know more details about the specifics of our projects, for sure, contact us.
Yeah, contact them, because you know what I keep saying about that COVID research is when I describe it to others, I've mentioned that we wanted to make sure that during this global pandemic, that the Indigenous population were able to say what works and what doesn't work for them. So when the public health measures that are declared don't necessarily work for the Indigenous population, which we've seen in this case, some of our rural and remote communities struggle with the declaration of isolation, and food security is not easy in some of the rural and remote communities. I know we're focused on urban, but what we've also noticed during COVID is that it's been transmitted from travel, from community members coming to the city and then going back to community. So just learning so that, you know, as in previous pandemics, the Indigenous population, where many of them lives were lost, there wasn't necessarily an opportunity like we have now to really learn what works best for this population. So hopefully we get some of that out of this as well, particularly for the urban Aboriginal population. You two have been amazing with leading that work, and I know, Brittany, you also mentioned some mentoring for Indigenous students, for folks like you know, Colleen from our team. You were able to mentor her with her research project. She got a small grant from VCHRI and Vancouver Community to do a little bit of work. I think more and more, as you talk about your work, and of course Dr. Brittany Bingham, when we were able to announce in partnership with CGSHE that we were hiring together in this partnership, Dr. Brittany Bingham having completed and defended her PhD on June 26th, that she would be the first Director of Indigenous Health Research at Vancouver Coastal Health, the first not only Indigenous health researcher, but also from our Vancouver Coastal Health region, Sechelt Nation. You know, that's an amazing amazing accomplishment for you, of course, personally, but also for us, that we were able to attract you to this role. And I hope it encourages other young Indigenous women and guys, all people, all Indigenous people, like Shannon as well, to be able to accommodate Shannon in her career aspirations, as well as her post-secondary and her education goals, is just a perfect fit. And it's you mentoring again, Brittany, and hopefully mentoring many others that have any interest in working with you and your team around privileging the Indigenous lens and Indigenous knowledge in their research. So I know you guys would welcome anybody to reach out to you. Thank you so much for an amazing presentation. It really is just the start of a big, long, wonderful future that you both have in research. Hands held way high for both of you. Thank you so much for all that you do.